Chairperson, AHEL, Dr. Sangeeta Reddy, Joint Managing Director, Apollo Hospitals Education and Research Foundation. A warm welcome to everyone gathered here today for this momentous occasion, the white coat ceremony of our newly joined medical students of the 2025 batch. It is indeed my proud privilege to extend a very special welcome to our chief guest, Dr. KJ Reddy Garu, Professor and Senior Consultant, Orthopedic Surgeon, Apollo Hospitals, Hyderabad. With an illustrious career spanning over 30 years in orthopedic and joint replacement surgery, and having performed more than 7,000 successful joint replacement procedures, Dr. Reddy stands as a shining example of clinical excellence and professional dedication. We are deeply honored by your presence today, sir. A warm welcome to our Dean, Dr. K. Manohar, MD General Medicine, a visionary leader whose dynamic guidance and commitment to academic excellence continues to elevate Apollo Medical College among the top medical institutes of the country. Welcome you, sir. I value tireless dedication to nurturing young minds and shaping them into competent, compassionate, and ethical professionals truly defines the spirit of this institute. It is equally heartening to see our senior students participating and volunteering in today's event, a wonderful reflection of the camaraderie and mentorship that define the Apollo family. To the parents of the students who've joined us, I'm sure you're very proud of their achievements. Congratulations. Your encouragement, sacrifices, and unwavering belief have paved the way for this achievement of your children. Thank you for the trust reposed in us to take your children forward in their careers as medical professionals. We welcome you to the Apollo family. To our new students, today marks a defining moment in your lives, the beginning of a noble and lifelong journey in medicine. As you don your white coats for the first time, remember that it is not merely a garment. It represents your commitment to uphold the highest standards of professionalism, to respect the autonomy and dignity of every patient, and to provide compassionate and evidence-based care. You're about to embark on a journey filled with discovery, challenge, and growth, supported by the world-class education, cutting-edge research opportunities, and a nurturing environment that will help you become the best version of yourselves. Congratulations to each one of you for reaching this milestone. Your dedication and perseverance have brought you here. May this white coat ceremony inspire you all to uphold the values of integrity, empathy, and excellence that define the medical profession. Thank you, and my best wishes to the 2025 batch.
It stands for purity of thought, sincerity of purpose, and reminder that to heal is sacred and to serve is divine.
Becoming a doctor is more than just a profession. It's a calling, a pledge to serve, and a promise to always put the needs of others first. As they embark on this journey,
and our Chief Operating Officer, Ms. Aparna Reddy, Medical Superintendent, Dr. Satyan Reddy, Associate Dean, AIMSR, Dr. Neeta, and all my beloved colleagues of different heads of the department, professors, associate and assistant professors. My dear students of batch 2025, for this occasion, I also welcome their parents, guests, print and electronic media. A warm welcome to this white coat ceremony. Now this is a ceremony. The Apollo stands for organizing all the events which is supposed to be any medical college across the world. Now I am proud to be here for many reasons. last 3 years I am attending this type of events. Now this is the special thing for the young students who entered into the medical college. This symbolizes the commitment to the medical profession, ethics, the patient care, and most important is the commitment to study medicine lifelong. Now this is the responsibility as you shoulder this white coat after taking an oath today. You have to nurture all these things. That is the importance of white coat ceremony. Way back in the before 1990s, this ceremony was not there. It was in one of the universities in US, Columbia University. They started, the pediatric neurologist, Dr. Arnold Gold. See, they have an event, a badge mark to give the responsibility. Now, when you don this white coat, the professionalism as you, after your basic science, goes to the ward, with these coats, when you are walking down, it is you with the knowledge of the basic science and your continuous reading, you attract the respect from the patients. While doing so, please follow the ethics. This is very important throughout your life. Medical profession needs in a continuous the practice of the ethics in medicine. Now, third component of this responsibilities is the continuous reading. Now, unlike other the subjects, when you compare with your colleagues of engineering side, they do read like that, but medicine needs a special attention. The quote by a famous physician, William Osler, he said, to study the disease without books is to sail an uncharted sea, while to study books alone, not to go to sea at all. Now yours study continuously for lifelong as the disease profile changes itself, as we have seen in the decades past few years. What we read 50 years back, what we are practicing is different. So hence the importance of your continuous reading. Now while achieving these goals, you may go for a lot of stress. Now mind you, while you are attempting all these things, please take care of your health. It's a physical health. Allot some time for your activities, exercise, your mental health. Because of the sudden transition from your intermediate and the medical profession, you looks like an abandoned books and so much of syllabus. Unfortunately, your duration of first phase has been condensed. Do not face any stress. We at Apollo, we take care of your mental health by conducting some stress-free lectures to practice it. Above all, we also inculcate you for the meditation and the yoga classes. So my suggestion is, don't be the victim of burnout syndromes. You plan your day in such a way that how much time you have to allot to your studies, how much time to your physical health, how much time to your... Then only you will be the best doctor. Then only the final component of the profession where you ready. So enjoy the ceremony. Now the procedures will start very soon. With these suggestions, I take leave. Thank you very much and best of luck.
Dignitaries, faculty and parents here, and most of all, good morning to the young students over here. And I am honored to be here on the occasion of the significant milestone of the White Coat ceremony. Chief guest for today, Dr. KJ Reddy. On behalf of everyone, I extend a very heartfelt welcome to Sir, who is a renowned orthopedic surgeon. His remarkable career and expertise make him the ideal person to be with us today on this occasion. Dr. KJ Reddy has an impressive 31 years in the medical field as an orthopedic surgeon. Following his medical education in esteemed colleges in India, Sir went on abroad to the UK and spent 14 years there building his clinical expertise. Since then, he has done extensive work in joint replacement surgeries. Sir specializes in complex primary total knee replacements and total hip replacements, along with joint preservation through several advanced procedures like stem cell therapy, ensuring cutting-edge patient care. Throughout his career, Sir has been recognized for his valuable contributions, notably receiving the Michael Bastow Audit Prize in 1993 at Queen Elizabeth Hospital in the United Kingdom. As examples to his leadership skills, he has served as President of the Indian Arthroplasty Association from 2015 to 2016, as well as on the Telangana Orthopedic Surgeons Association from 2016 to 2017. Currently, Sir serves as a board member for Arthroplasty Society of Asia and is also the Chief Joint Replacement Surgeon at Apollo Hospitals Jubilee Hills since 2003. In addition, Sir has also received and published several research articles to add to his credit. Dr. KJ Reddy is a trusted orthopedic specialist who uses his extensive knowledge as well as compassionate approach to improve quality of life and patient care. As a pioneer in the medical field who has changed countless lives, your presence here makes this occasion truly special, sir. And as a token of our gratitude, we would like to present Sir with a small bouquet which our Dean Sir will be presenting. Please join us on the dais for a few words.
Good afternoon. Thank you very much for your kind introduction that made my day. Respected dignitaries on the dais, Aparna garu, known her for a very long time. Manohar garu, Dean, know him for quite some time, and medical superintendent, faculty, students, parents, occasion for you to start your career because you're so special in the society. Nobody else get so much of respect in the society because you are the future of medicine and you are the heroes of the people who believe in medicine. So you should keep that position special. I remember my days, I used to come from Yesnagar to Usmania. Those days we used to carry our white coats. And on the road we put hands on his bus. He used to stop. Because our white coat used to have a lot of respect. When we go inside the bus also, people used to look at us. We used to feel very proud. I'm sure there is, even now, doctors are respected, very well respected in society, and we should live up to it. As Dr. Manava said, keeping our ethical values, practicing medicine based on evidence, which is very, very important. And medicine is advancing so rapidly. Every day it changes. If you blink, new thing will come. So it is just the beginning of your career, and you have to go on till you practice medicine. And like Manav said, that stress, there is nothing like no stress in the career of life. Everybody will have stress. The key is how to manage the stress. Very, very important. You should train yourself to manage stress, because we all get stress. Waking up in the morning, going on the road, driving, coming to the hospital, and dealing with your friend, everything is stress. But you have to manage. You have to have, everybody have their way of managing stress. what happens? If you carry 5 kilo weight on your hand for some time, it's heavy. Carry about 20 kilos. For 1 minute is okay. But if you carry longer, what happens? Your hand will fall, become stressful. So the most important factor is don't give the stress in the mind. Forget about it. Move on. You have to manage. You have to learn to manage. I keep saying, because I've been attending so many things about Freshers Day, and I keep saying ABC, very, very important. In medicine, we call airway breathing circulation. But your career, ABC, your attitude, your behavior, and your communication. Your attitude is very, very important. When you come to the institution, just say hello, smile at people, even if you don't like them. Next time, they will be softer to you and probably become friends. Just say hello in the morning, good morning, doesn't matter. You are not going to lose anything. So your attitude is very, very important. And the way you dress, because people judge you, patients especially judge you, your colleagues will judge you, your professor will judge you, how you dress yourself, how you present yourself, very, very important. So present yourself in a presentable way. Behavior, very, very important. You have to behave with your colleagues, your parents, your professors, patients. You have to be very polite. I'm sure some of you met our chairman, beloved chairman. I met him in 1996 in London. He used to come to London to recruit doctors in Apollo. I met him a long time back. And he said, whenever you come to India, because I never thought I'd come back to India at that time. Whenever you come to India, Apollo, Hyderabad is there. Please come and join. I came back 2003, joined in Apollo, never looked back. And when you enter his room, do you know, he gets up. He comes to you. He's a big man, legend, changed the corporate hospitals or the corporate healthcare in India. He is the visionary. Because of him, we are able to do so many wonders in medical care. So take him as an example. Don't lose anything saying hello to people, being polite to them. And communication. I keep saying communication is the key for your success. If you see any good doctor, his communication is so excellent because medicine is nothing but communication. When patients comes to you in your clinic, talk to him nicely. 50% of the disease will go away. Talk to him nicely. This morning I saw a patient. We have two, of course, AIMS also. We have two types of patients carrying big files. One category will be the genuine problem, have multiple treatments. The other one, normal person, had so many investigations, healthy person. But his problem is, nobody is recognizing him, nobody is talking to him. This morning he came, sir, I've seen, he came from Chhattisgarh. So many doctors, so many hospitals, nobody tells me what's wrong with me. So I made him sit down, he came with few people, spoke to him, asked him what he does, and spent some time and asked him to history, because listening is the key. A good listener is a good doctor. Listen to the patient, you'll get diagnosis. Then I listened to examine him, there's nothing wrong. I saw all the investigations, spent a few minutes. Then I can change, I can see his change in attitude. डॉक्टर साहब, आप पहले डॉक्टर हैं, पूरा देख लिया, पूरा सुन लिया, मेरा डिसीज खत्म हो गया। आप बोलो कुछ नहीं है मेरे बॉडी में, I will be very happy. That's how people, because they expect you to listen to them, they expect you to see their reports, and the main problem is may not be the disease, something else is bothering them. So it's important, listen to them, communicate with them. And when you become a good doctor, you have knowledge. You have to have confidence. When you become confident, if you know the medicine, and these subjects, initial subjects, anatomy, physiology, biochemistry, they are the foundations. Do you know, many buildings, old buildings, bridges, they're still working, functional, because foundation is good. So you should have a sound foundation. Anatomy, unless you know normal anatomy, you would be knowing what is abnormal. Like physiology, like biochemistry. And then next year, next semester, next term, you read about what is abnormal. Then in the final phase, you find out, put together, find out clinically how the patient will present to you. So it's very, very important. Even at this level, at any level, these basic subjects are very, very important. So, anatomy, physiology, biochemistry are important. And we have excellent infrastructure, I can see, excellent professors. Only thing is, you have to use them, communicate with them, learn from these excellent facilities created by Apollo group, Apollo family. And there is everything for you to become the top of the tree. Do you know, in the past, most of the doctors, I think there was a survey about 10 years ago, 1/3 of doctors used to give up their profession, join something else. Those days, real estate was the big thing. 1/3 used to leave abroad. Probably 1/3 stay in India, go higher studies. Probably now things have changed because opportunities are more. So you should be the top of the society, as one of her said, you have to continue studying, reading books, spending sleepless nights, then only you become the top. But do you know, the most important thing is your health. Everyone will have so many problems, 1,000 problems. But once your health is spoiled, you will have only one problem. That's your health. Day and night, you only worry about your health, nothing else. So your health is very, very important. Especially your mental health. Unless you are healthy, fit, you can't become a good doctor. And patients won't come to you. You won't learn unless you are healthy body and healthy mind. So it is important that you keep yourself fit and well. I'm not saying 24 hours you read. Do you know what needs to be healthy? 3 things. You have to have good diet, good sleep, and good exercise. So throughout your career, stick to these 3 things, you will stay healthy. And of course, nowadays AI, artificial intelligence, is kicking in. Unless you know it, you will be extinct. Other day I was attending one of the AI meeting. They were saying most of the employees will be taken out, or most of the people will be unemployed. Yes, it is true. People who are not trained in AI, who do not have the knowledge, will become unemployed. But those who integrate AI, they will be very successful. They still stay in the system, including doctors. We have to integrate. In Apollo, we have robotic systems. I do robotic knee replacement, robotic hip replacements. Robotics made our life very simple, precise, painless, and fast recovery. So you should be the innovators. There are so many problems in medicine. For example, you take knee arthritis, nobody knows why arthritis comes. You should investigate, you should do research, find out why Indian people suffer from osteoarthritis more than anyone else in the world. So you start looking in those research points from the beginning. Then only you will become the leaders in the medical society. I can go on forever. Most important thing in your life is your health. Next most important thing is your parents. They work so hard. to bring you to this level. They are very proud of you. And keep them proud the rest of their life. Do you know your success gives more happiness to them than their own success? Wish you all the best. Have a great afternoon. Thank you once again.
And encouragement for our pending doctors. And now, the most awaited moment, the white coat donning ceremony. As your names are called out, we request you to wear the coat with pride and humility. Please arrive from right of the stage and depart from the left.
And don't forget to smile your happiest so our photographers can capture your precious memories for you to reminisce later. As we commence, we request you all, lights down and phones down. We have official photographers to ease your afternoon so you may enjoy this moment you as family have long looked forward to.
Kindly come forward.
Kaka, చెప్పు కాకా ఎవరన్నా నేను లేనన్నా వేరే
A.S. Rohan Prasad.
అయితే వెళ్ళిపోండి వచ్చాను
Anchal Maheshwari. Abhinav Sai Gundala. Aishwarya Pambari. Akshara Yarlagadda.
స్వామి
Alan Nidhi.
We now request your needs, sir, and over to you.
Anand Johan Rajkumar. Anantu Rutvika. Anu Satya Sripada Vaishnavi Chandra. Anaushka Sharma. Ariba Anam Khalil. Arjun Narayan Aspati.
Thank you, sir. We now request Dean, sir, to kindly do the honors.
Aparna Reddy Gangavaram. Aparna Reddy Malebali. Aryan Kadam. Aturu Samanvi. B. Beta Shivani. Bandi Charita.
Thank you, sir. We now request Aparna ma'am to kindly do the honors.
Banotu Aradhya. Bhavi Gada Sham. Benny Hansini Inteti. Bettina Florence. Bhavya Bandari. Rimi Reddy is Aisha.